And he was aware, was he not, that the patient was being weaned, true, in the 12 o'clock note of Marilyn Abbott? Do you see that, doctor? What page is that? 12 o'clock note. I'll be with you in a moment. It says Dr. Kaufman is aware of the patient being on pressure support of 10, and he should know that is less than the patient was on before, so that he is aware the patient is being weaned. Okay, so it's fair to assume that he was well aware that this patient was going to be extubated. Do you agree with that? No, he was aware the patient was being weaned, as I said in my testimony before. Okay, now we are going to move off Nurse Abbott's note and go back to the surgical notes. Doesn't he say early extubation should be done in that note? It says expect early extubation. Okay, so he knew there was, and he also expected to do early extubation. Is that correct? That's correct. So we can say that death of the patient on November 6th was totally unexpected. Isn't that true? That would be true. And he said as much, isn't that correct? I don't recall. You mean in the deposition? In the autopsy report. Take a look at it. In the autopsy report, right. Yes, sure. Don't look at the report. Look at the notes, especially the interview done of the doctor, the first sheet that bends out. It was done of Dr. Kane on the evening of November 6th. Do you see that? I would expect that every physician involved would know that. I just want you to read the note. What page? Plaintiff's counsel, the witness is answering a question. I object to his being cut off. Defendant's counsel, Your Honor, I asked the question of the witness, was the death of the patient totally unexpected by Dr. Kane? And he said as much. Plaintiff's counsel, he was quoting an answer and was cut off. The court, all right, don't cut the witness off. Did you answer that question? I was trying to. The court, you were trying? Can I? The court, yes, you can. Go ahead. I'll ask it again. Dr. Kane stated that the death of Virginia Johnson was totally unexpected, and he said as much on November 6th. Didn't he? It's right before the date in the left column. Do you see where it says that? Yes, it states that this is a totally unexpected result. Doctor, you read the testimony of Susan, the nurse, did you not? Yes, I did. And on that particular point as to what she testified to regarding examination, I want to ask you if this refreshes your recollection, reading from the testimony of Susan given on page 100, line 6, question, Ms. Smith, at that time, was it your understanding as a respiratory therapist that you should not extubate a patient unless you could also re-intubate the patient if necessary? Does that aid your understanding of your duties as respiratory nurse? Answer, if you feel comfortable doing it. Question, at that time, when this patient was extubated, at the time she began to manifest difficulty, based upon your education, training, and experience, up to that point, did you feel that you could re-intubate that patient if you were allowed to? Answer, I could have made an attempt. Do you remember those questions and those answers by this witness? Yes. You do remember them? Yes. Defendant's counsel, Your Honor, I asked the question of the witness, was the death of this patient totally unexpected by Dr. Kane? And she said as much. Plaintiff's counsel, he was giving an answer and was cut off. The court, all right, don't cut the witness off. Did you answer that question? I was trying to. You were trying to? Can I? Yes, you can. Go ahead. I'll ask you again, doctor, and this time see if you can answer more pointedly and directly, if you will. Yes. She is significant of what? That can cause brain damage and cardiac arrest if it's not treated in a timely fashion. No question that cardiac arrest can cause death? Yes, no question about it. Doctor, would it have been good practice at this time to attempt a re-intubation? At this time, it would have been not good practice for her to attempt re-intubation because the patient is, can I finish my answer? Plaintiff's counsel, he is interrupting again, Your Honor. Defendant's counsel, Your Honor, I appeal to you. The court, the witness answered the question and then continued on, and I instruct him, as in the past, please try not to do that. In fact, doctor, if possible, try to answer my questions yes or no. Okay, okay? Okay, yes. And if you will, doctor, let me remind you that Dr. Cobbs testified when he was here on Wednesday that on the afternoon of November 6th, after the patient was extubated and while she was being monitored by the nurses. When that patient began to manifest stridor, she should have immediately been reintubated. Is that right? Yes, it is. What is stridor, doctor? Stridor is a harsh whistling sound during respiration. That is, it aids in the passage of food. And was it manifest stridently? She should have been given oxygen. Was that your opinion at that time? Correct. So you don't agree, or in any event, you don't feel that she should have been intubated or reintubated when she began to manifest stridor. True? That is my opinion. Doctor, have you ever given orders to a respiratory therapist to extubate a patient? Yes, from time to time. Have you ever done that over the phone? No. Do doctors order extubations of patients over the phone? Yes. And that is given to respiratory therapists to do? In some hospitals, I suppose so. In New York State, respiratory therapists are certified, isn't that correct? Yes, that is right. What is a certification? What does that mean? It means they have been trained and have passed a test. Okay, and they are allowed to do certain things, correct? Yes. For example, they are allowed to administer medications. Yes, they are allowed to administer medications that they have been ordered by physicians. Fair enough. And are they also allowed to intubate patients? They are allowed to intubate patients. And they are allowed to extubate? Yes. In fact, doctor, based on your experience and your skills, extubation and intubation really are inseparable. Isn't that true? I mean, if you are going to extubate somebody, you should be prepared as a general preparation to re-intubate them, correct? I can't answer that yes or no. Doctor, for how long a period of time after the plaintiff was extubated on the afternoon of November 6th did her oxygen saturation remain in the range of 96 to 97%? I can't tell from the hospital chart. I'd say no more than 19 minutes. No more than what? 19 minutes. Okay, but there was testimony from the nurse on this point, wasn't there? Testimony in court, or what do you mean? In the deposition. In the deposition, yes. I don't recall, however, that the specific testimony was given. Well, didn't they say that there was a period of time where the patient was doing fine after extubation? Yes. They don't need to be intubated. Some patients with stridor get worse and clearly require the need for intubation, so that is why I said before that it wasn't necessary. The patient had to be intubated when the saturation was normal, 98%. The patient needs to be watched closely to see which way the patient was going. Doctor, next time you can't answer the question yes or no, just wait. We will move on to something else, okay? Doctor, let me ask you this. When did the stridor first appear according to Nurse Abbott? I don't recall her exact testimony, but my remembrance is that it fell quickly and developed quickly. Gives you a run for your money.